administering oral, sublingual, and buccal medications. For this procedure, you will need the physician's order for the medication, the medication record, a medication card or dispensing computer, disposable medication cups, a glass of water, juice, or other liquid, a pill-cutting device if needed, a mortar and pestle if needed, applesauce or custard if needed, and paper towels. Wash your hands. At this time, you should unlock the medication cart or log onto the computer. Organize and arrange the medication tray and cups in the medication room or on the medication cart outside the client's room. Prepare the medication for one client at a time to avoid mistakes. Select the ordered drug from the medication drawer. Check the expiration date. Check the medication against the client's medication record. Calculate the drug dosage if needed. Check to make sure you have the 5 rights: right client, right medication, right dose, right route, and right time. To prepare a tablet or capsule, pour the required number of tablets or capsules into the bottle cap and transfer to a medication cup without touching them to avoid contamination. Scored tablets may be broken if necessary, using gloved hands or with a pill-cutting device. A unit dose tablet should be placed directly into the medicine cup without opening it. The wrapper will keep the medication safe from contaminants and will make it easy to identify when it is administered. If a pill is too large or a client has difficulty swallowing, some tablets may be crushed into a powder using a mortar and pestle or by being placed between 2 paper medication cups and ground with a blunt object. Then the medication can be mixed in a small amount of applesauce or custard. Be aware that time-released or especially coated medications must not be crushed. Check with the pharmacy if you are uncertain. Liquid medication. To prepare a liquid medication, remove the bottle cap from the container and place it upside down on the cart to prevent contamination of the inside of the container. To keep spilled liquid from the label, hold the bottle with the label against the palm of your hand. For accurate dosing, hold the bottle of medication and the medication cup at eye level while pouring. Fill the cup to the desired level using the base of the meniscus as the scale, instead of the edge of the liquid. Wipe the lip of the bottle with a paper towel to prevent the bottle cap from sticking. To obtain a controlled substance medication to administer to a client, obtain the key to the controlled substance drawer and open it. Locate the specific controlled substance you will be administering. Remove the prescribed amount of the controlled substance and record the required information on the Narcotic Administration Control Record. Be sure to sign the record and lock the controlled substance drawer. When you are finished preparing the prescribed medications, be sure to return the remaining stock medications to their shelf or drawer. Place the client's medication record with the prepared medications to ensure the proper identification before administration. Remember to never leave drugs unattended. To administer medications, complete the 3rd check of the medication against the medication record to make sure you have the 5 rights. Check the wristband to verify the client's identity. Ask the client about any drug allergies. Next, assess the client's condition and ability to tolerate the form of the medication. Perform any assessment required for specific medications such as a pulse or blood pressure. Explain the purpose of the medication. Assist your client to a sitting position to facilitate swallowing. For oral medication, allow your client to hold the tablet or medication cup as she desires, and provide her with a glass of water or other liquid, and a straw if needed, to help swallow the medication. To administer sublingual medications, instruct the client to place the medication under her tongue and allow it to dissolve completely. If swallowed, the drug may be destroyed by gastric juices or detoxified in the liver too quickly so that its intended effects will not occur. To administer buccal medications, instruct the client to place the medication in her mouth against the cheek until it dissolves completely. After administering the medication, remain with the client to verify that the dose has been swallowed or dissolved. Assist the client into a comfortable position. Dispose of soiled supplies and wash your hands. Finish by recording the time and route of administration on the medication record. To administer oral medications through a nasogastric tube. Most institutions require the physician to be notified and in order to be obtained to administer oral medications through a nasogastric tube. Use liquid medications if available. If not available, make sure that each specific medication may be crushed. If the medication is sustained release or especially coated and you are not sure that the medication can be safely crushed, check with the pharmacy. As you walk in, provide for privacy. Verify the client's identity and check the physician's order. Wash your hands and put on clean gloves. Recheck the medication against the doctor's order and the client's identification. If the medication is a crushed tablet or capsule, mix the medication with 20 to 30 milliliters of warm water to dissolve. Elevate the head of the bed so that the client is sitting in a Fowler's position to prevent aspiration of gastric contents. Check the placement of the feeding tube or nasogastric tube before instilling anything but air into the tube. Check the residual volume of the stomach contents to make sure the client is absorbing the fluid that is being administered. After you have verified the NG tube is in the right place and that the client is absorbing, pour 20 to 30 milliliters of water into the syringe barrel of a 60 milliliter Luer-Lock syringe that is attached to the nasogastric tube. Flush the tube with the 20 to 30 milliliters of water. Pour the pre-mixed and measured medication into the syringe barrel and allow the medication to run into the nasogastric tube by gravity. Finish by flushing the nasogastric tube with 30 to 60 milliliters of water. If there is more than one medication and the client is not on a fluid restriction, administer each medication separately followed by 10 to 15 milliliters of water. This practice may help prevent these medications from mixing in the nasogastric tube and clogging the tube. Leave the client in a Fowler's position for at least 45 minutes after administering fluids through the nasogastric tube. Remove your gloves and wash your hands. Keep track of the amount of total fluids administered and record on the I and O sheet. Record the medications administered on the medication record and record the assessment of the NG tube placement and residual volume on the form designated by your institution.